we are going to discuss regarding asthma. Asthma is a chronic inflammatory disease in bronchi and bronchioles in the lungs. Asthma is reversible and it is acute attack. The pathophysiology of asthma. There will be bronchoconstrictions. The bronchioles and bronchi will be constricting and there will be wet and mucus filled lungs, completely filled with mucus, and wet fluids also will be there. That will constrict the bronchioles. So, what will happen? The decreased oxygenation by inhalation. Oxygen will be decreased to the lungs. And finally, the air trap inside the lungs. So, when the air is trapping inside the alveolus, the carbon dioxide will be increasing inside the lungs. When the carbon dioxide is increasing, the blood, instead of oxygenated blood, the blood will carry more carbon dioxide to the tissues and the blood supply. That will cause acidosis, and finally it will lead to respiratory failure. That is the pathophysiology of asthma. Now we can see the signs and symptoms of asthma. There is a mnemonic for signs and symptoms, that is asthma. A means accessory muscle use. The critical sign is paradoxical breathing. So, accessory muscle use for the breathing is a sign for asthma, and the critical sign we can see that paradoxical breathing. What is paradoxical breathing? The opposite of normal breathing pattern. When we are inhaling, the lung will expand and more oxygen will go inside, the diaphragm will push us down, and during the expiration the diaphragm will move up and the air will be pulled outside from the lungs. That is the normal respiration. So, opposite of this, that is paradoxical breathing. Next signs and symptom is S, that is shortness of breath and dyspnea. The critical sign for asthma. T means tight chest and tachypnea. H means high pitched wheezing. Introducing the all new Nursing Mantra Nclex series, which contains study materials and video crash course, specifically designed for easy access and most convenient method of study. The series has been divided into 5 main parts. Question bank, rationale followed by each question, the explanatory video collections with the help of illustrations and animations, exam handbook, and finally we have the mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Mantra WhatsApp.